So let's go over your scanning results. And this technology that we've acquired pulls back the curtain for patients to see what the doctor feels and sees in the spine. So I often get the question, what are you feeling for on my spine? Or what do you see? Well, the answer is joint restriction and motion imbalances, muscle tension, inflammation or swelling, and the quality of nerve function. Now you can see that too in clear, colorful graphs showing your spine compared to normal healthy spines, muscles, nerves, activity, and even your body's ability to adapt to stress and regulate organ function. Now those last two, not even I was able to see before using this technology. So that's truly amazing. So another added benefit is by repeating the scans every few months, we can see your progress, catch problems in the very early stages, and make lifestyle changes that promote long, healthy lifestyles. So first is the neural efficiency score. So we're looking for this score to climb as close to 100 as possible as your health moves away from challenged toward excellent. We're here to help you do this by helping you with your nutritional, structural, and neurological needs. Now, this core score is helped through all health habits, including chiropractic adjustments, core balancing exercises, and avoiding imbalancing habits and postures, and what you eat, drink, breathe, and how you think, sleep, and move. All right, so our first main score here is the autonomic nervous system score. The vertical midline is your ideal balance between stress, sympathetic, and rest, parasympathetic activity. There's a range of normal around that center vertical line, which is the width of the green zone, which is 85 to 100 and back to 85 on the other side. 100 being ideal. Too far to the right, and you've run out of your capacity to respond to stress adequately, typically due to chronic stress. This fatigued sympathetic stress response leaves you vulnerable to physical, chemical, and mental stressors. You may need to pass back through zone 3, 2, or 1 for recovery to get you to zone 5, depending on where you start. Now, too far to the left, and you have too little vagal tone, not allowing for your adequate recovery, resulting in a slower rate of recovery. If you stay there too long, you'll drift into zone 2 or zone 4. If your balance is 85 or closer to the midline and steady or improving, your balance, your autonomic nervous system balance is not the primary problem. So you're in a good zone. The horizontal line, horizontal, at 68 is the minimal autonomic activity. The goal is to be 80 or above. When you drop below the 68 level line, it means you have essentially run out of gas. Refueling the autonomic activity requires both nourishing and gently activating or exercising the nervous system. Draw a line from your white plot dot to the center of the green zone 5. Now draw a line from your dot to each lower zone, then into the center of 5. You may need to recover through each of the lower zones before entering the ideal zone 5. One recording is information. This tells us what reserve you have left, but not where you're headed. 2 measurements show if you can change. And 3 measurements, or 3 scans, is a story that shows a trend. All right, so our next scan is the muscle nerve activity, or SEMG, standing for surface electromyography. There's so much rich information to help us and you understand your spine, muscles, and nervous system, protecting and controlling the core of your body. Not only does it house millions of neurons traveling to and from your body, it is the foundation, the structural and functional core of all body movement and posture. There are 2 images that summarize how well your body, the core of all body movement and posture, how well it's maintaining that core. So the first thing we learn is energy expenditure and pattern. Energy expenditure, or energy index, is there enough or is there excess overall nerve and muscular activity to withstand normal gravity and stress? The next is the pattern or efficiency. Is this activity distributed ideally from bottom to the top of your spine? And third is symmetry. That's the second picture. In this activity, is it distributed ideally from side to side of your spine? All right, so let's look at muscle energy expenditure and pattern first. Is there enough or excess overall nerve and muscular activity in the right places to withstand normal gravity and activity stress? This picture on the right shows an ideal energy and distribution. The hourglass distribution is outlined by the white lines. The image on the left shows a common scan with some ideal and some muscles under strain and others fatigued and underactive. The yellow bars indicate the low or underactive tone, often from chronic exhaustion and long-term adaptation or relaxing transition from overactivity. The white bars indicate a normal activity range. Green is mildly excess tension, blue is moderately excess tension, red is high excess tension, and black is extreme excess tension. Although white and balanced into an hourglass shape is ideal, colors are an indication of the body struggling to adapt and are not necessarily bad function. It's just where you want to stay. Some adaptations are an attempt to stabilize or relax along the path to rebuilding and recovery. Look for your energy expenditure to get closer to the ideal of 100% for adults as your spine improves. Note, in 5 to 13-year-olds, the ideal may rise to 125%. Outline your energy bars on the left and right of the spine. How close is yours to the ideal? See if it shows that hourglass shape. We're here to help you do this by help restore this balance by helping you with your nutritional, structural, and neurological needs. This symmetry is usually helped mostly through chiropractic adjustments, core balancing exercises, and avoiding imbalancing habits and postures. All right, so the next is symmetry. Symmetry is the activity distributed ideally from side to side of your spine. The same color codes apply and are longer when the side-to-side differences are larger. There is no yellow in this case. Long colored spikes indicate greater tension on one side of the spine compared to the other. As you might imagine, this creates a shear or rotational strain on the spine and the related nerve activity. Not always, but often, large spikes are in areas that you also have pain. Mark an X on the spine where you have the largest spikes off to the side. Look for this score to get closer to 100% symmetry as your body balances and heals. We're here to help you do this by helping you with your nutritional, structural, and neurological needs. This symmetry is usually helped mostly through chiropractic adjustments, core balancing exercises, and avoiding imbalancing habits and postures. And for those of you who are more analytical, you can see the footnotes for more information. The next is our neural thermal scan. The neural thermal scan measures how well your spine and nervous system are regulating all the different body functions. Thermal balance is the temperature measured on the left and right sides of your spine, helping measure nerve health related to organ function. This thermal balance temperature is determined by the blood flow. This blood flow is determined by nerves, controlling the blood vessel diameter. These nerves are branches of the same sympathetic nerves that regulate organ function deep in the body. If your thermal balance is off, you're more likely to have organs that are off, malfunctioning, or stressed. This is called dysautonomia, which means bad function of nerves that control organs and bad organ function. Circle the spinal levels on the nerve chart. We'll circle the spinal levels on the nerve chart where you have the largest thermal bars. Then notice which organs and functions are related to that nerve level. Now look for the score to get closer to 100 as your spine and deep nervous system become more healthy, deal with stress well, and are not stressed for an extended period of time. We're here to help you with this by doing what it takes to improve you nutritionally, structurally, and neurologically. And again, for those of you who are more analytical, see the footnotes. Your nutritional, structural, and neurological needs include what you eat, drink, breathe, and how you think, sleep, and move, which is exercise, posture, and chiropractic. And finally, there are comparative or follow-up scans. Okay, so when it's time to do your rescan, of course, we want all scores to be closer to 100, right? With all comparative scan results, will they all look better? Well, not necessarily. Commonly, the second scan shows mixed results. The rainbow graph, the adaptive reserve, often improves and stabilizes, while at the same time, the EMG may look worsening in the early stages because the body is investing new postural and regulatory energy. So the EMG may show lower or higher bars. A minimum of 3 scans is necessary to measure the trend. A common process is that the nervous system first destabilizes to reorganize. Then it stabilizes a foundation to rebuild. Then finally it optimizes function. In the rainbow graph shown, the second one is looking better. As you can see, the little white dot representing the example position has gone from zone 3 to 1 and is getting closer to the green zone, zone 5. In the EMG of postural muscles, this does not look better because the scan shows more color. But recall that the white is ideal, but it could be better because it shows change, which is what we want to see. In the early stages of recovery, especially from chronic conditions, this unwinding allows for rebuilding the right way. So even though it may not appear good, just looking at the result in isolation, if you have been breaking bad habits, adding good habits, including your prescribed therapy, and you've received your adjustments on a regular rhythm as prescribed, you'll likely notice that other results show obvious improvement in your pain, energy, and maybe even your sleep have improved. If none of that has improved, we'll need to take a serious look at what's causing your body to respond so poorly, considering physical, chemical, and mental and neurological stress. So change is good, especially when accompanied by measurable improvements in other areas. And finally, this is the health trajectory graph. Now you get to choose your path. At the beginning, we are in the initial intensive phase. There are fewer options here. At this point, you choose your goals, and we do the evaluation of your condition. Those 2 points, the beginning and your goals, determine our treatment recommendations. So the only real choice is to change your health or change your goals. This really continues to be the choice going forward. How well-functioning and good feeling do you want to be? And are you willing to do what it takes to get or stay there? All right, so that's the end. If you have any questions, feel free to ask us, and we look forward to your long and full recovery.